I have a very interesting case I want to go over today. This case presented to the office on June 2nd, and the gentleman came in with right-sided shoulder pain that started about 10 months ago, and it was affecting his work as a welder. It was difficult for him to stretch out his arms. Now, when I went through the chiropractic analysis and found nerve pressure, there were other questions I started asking him about that we would generally see symptoms in those areas. And here's what we found out. He had both right and left knee pain greater than actually the complaints that he had as shoulder, but that was not his original complaint that he came in with. As we went further through the exam, some of the other things we found was left-sided groin pain. He had heart palpitations a couple times a month, and he had numbing in the right forearm daily, and he had sinus issues. I'm going to go over the A to P X-ray today and show exactly what was going on in his case. What I want you to see here is just in the overall view of the spine, you can see from S2, you can see his entire spine is shifted over here to the right side by 17 millimeters. So his overall weight bearing is very much off. I want to show you what's going on down in the pelvis and the sacrum so you get a better idea of how this is happening. In his pelvis, he had very significant amounts of misalignment and rotation here. The first thing that you can notice is the obturators. The size of the obturators is very much different. And if you look at some of the other videos, you'll see that anytime there's rotation in the pelvis, whether it's anterior or posterior, you will see either more or less of those obturators. So very clearly there's a lot of rotation on this pelvis. A 10 millimeter internal rotation on the right side. What you'll also see is that sacrum has shifted back by 7 millimeters on that right side. And when the sacrum shifts backwards on the right, you will see all these spinous processes shift over to the left side. And that's very clearly what's happening here. You can see every spinous process nowhere near the center. They're all shifted to the left side. There is a 10 millimeter leg deficiency on the right side. Undoubtedly, this is contributing to his knee issues, based strictly on biomechanics. Also, if you look at the shoulders, just overall posture, there's a 15 millimeter, his shoulder on his right side is 15 millimeters lower compared to the left side. We're going to take a look at the post X-ray. These were taken 12 visits later. The first thing that you'll notice is how much more he's standing up straighter here. Right here, you can see this plumb line, that's 17 millimeters to the center of the dens. Over here, it's now he's within 2 millimeters of the dens. So that's an 88% change there. Huge change. The other thing that you'll see is the spinous processes, which were completely rotated to the left, they're coming more towards the center. Huge change. Now, what happened here in the pelvis, this is really interesting. What you'll notice here is these obturator sizes completely reversed. On the pre-X-ray, this side is very large. On the post-X-ray, now they're either reversed or almost identical. The sacrum rotation has changed significantly. Where the sacrum was initially rotated on the pre-X-ray by 7 millimeters on that right side, now it is rotated by 5 millimeters on the left side. Absolutely huge change in this pelvis. Take a look at the view here, you can clearly see how much more normal it's starting to look on the right side now. The interim analysis was done on 7/14, so about 6 weeks later. He said significant improvement at this time. He said he doesn't worry about shoulders anymore, and what he said was before if he lifted something heavy he'd feel really bad the next day. He said that is gone, in his words right now. Groin pain. He said it's 10% of what it was before. And he said it seems like it's getting less and less all the time. Now, interestingly enough, his knee pain, he said, was 70% better. That's not what he came in the office originally for, but that changed significantly. What he told me is he has a history of bad knees in his family. Everybody in his family has knee replacements, and he expected to have a knee replacement in 4 to 5 years is what he said. And he's only 35 years old right now. But he said that's 70% better, so he's not going to need that. Now, these are some of the other things that he said. No heart palpitations anymore, no numbing in the right forearm, and he said his sinuses seem better. He said they're kind of gone. Absolute huge change in this guy's life. Post these x-rays up online. You'll be able to see the A to P in the lateral just by following the link below. I hope you found this video informative.